Hello everybody, my name is Joseph Goodman. I'm a cosmetic and restorative dentist, and today I'd like to talk to you about implants. So implants have three parts. One is the implant surgery, one is the implant crown, and one is the implant abutment, right in between. Connection between crown and implant. So here we have the implant surgery or implant itself below the gum line. Here's a crown and here's the abutment. The abutment goes over the implant. So if you don't have an abutment, you cannot connect your implant with the crown. So that's the bottom line. That's how it starts when you consider doing implants. Let's talk about some cases here. Thank you. So here's a very unique implant case. So we have an implant right here, tooth number 9, and the implant is usually at the same level as your gum. So you barely see the implant, if any. Now, the compromising case here was very interesting. Look at the distance between your tooth number 10 and 8. More than 50% of number 8, meaning if I would just take the same size and place it here, it wouldn't work. So we need to place 7 veneers and 1 implant. And by doing 7 veneers, we make every tooth a little bit wider, but then we can close this gap and make it look even. So look at this implant case. Now we're placing an abutment and a crown, and look how beautiful it comes out. There we go. Look at this. Same size, veneer, veneer, implant, veneer, veneer. Everything looks nice and even. Okay? So one more case here. Here's another case, very interesting case. This is your abutment. Remember I told you, here's your veneer, here's your implant, here's your abutment, and the crown goes on top of it. The abutment is your connection between your implant, which is inside your gum, and your crown. But there's something very unique about this. She has a lot of bone loss. So we place something called pink gum around the abutment to make it look like real gum. So when you're done with this case, pink gum is supposed to match the gum. So it doesn't look like your tooth is too long. So you have pink gum matching your pink gum. And overall, when you look at this case, your teeth don't look as long because there was a lot of bone loss. Okay?